Today, we are building something that you are going to use for the rest of your life. It's your own personal health toolkit. And forget about boring lectures. We're talking about stocking a toolbox with real practical skills that will help you navigate the pretty complex world of health and wellness. So let's get into it.
You've been there, right? I mean, we all have. Staring down a tough decision or just feeling completely lost, drowning in a sea of confusing health advice you found online. It can be super overwhelming. But what if you had a set of tools you could always rely on to help you cut through all that noise? Well, today we're adding 4 of them to your toolbox. First up, let's talk about making smart decisions. This isn't about finding some kind of magic answer. It's about having a solid process you can count on to find the best path forward for you. You can think of it like your own personal compass for navigating any choice, whether it's big or small.
And here is that process. It's called the DECIDE model. It's a really simple but incredibly powerful 6-step framework. First, you define the problem. Then you explore your options. Next, you consider the consequences of each option. After that, you identify the best choice. Then you decide and act on it. And finally, and this is a big one, you evaluate how it went. Following these steps helps keep you from making a rash decision based only on emotion. It forces you to be thoughtful, to be thorough, and it creates a repeatable process for smart choices.
Okay, this is a really important point. So often, we get stuck in this trap of looking for that one single, perfect, silver bullet solution. But reality is just a lot messier than that, and honestly, a lot more creative. The best answer might actually be a mix of a few different approaches. Shifting your mindset from finding the solution to building a solution, well, that's absolutely key. And here's the good news. You don't have to make these decisions all on your own. Bringing other people you trust into your process can be a total game changer. A friend, a family member, a mentor, they might see an option you completely missed or just help you look at the problem from a brand new angle. Just remember, the goal here is to gather different perspectives, not to have someone else make the decision for you. So, now you've got a framework for making decisions, but what do you feed into that framework? You need good information. And in this age of just endless online noise, knowing how to find trusted information, that's not just a skill anymore, it's basically a superpower. So let's add that to the toolkit.
And this superpower has a name. It's called health literacy. And I want you to notice it's way more than just being able to read. It's really a 4-part skill. Can you locate the information you need? Can you evaluate if it's credible? Can you apply it to your own situation? And, this is a huge one, can you communicate it clearly to others, like your doctor? Mastering these 4 steps is really the foundation of becoming your own best health advocate.
Think about it this way. Health literacy is not about memorizing an entire medical textbook. It's about being able to take solid facts, connect the dots between them, and then use that knowledge to make an informed decision that actually improves your life. It's the engine that powers that decision-making framework we just talked about. Now, a huge part of finding trusted info is knowing what to avoid. And honestly, the biggest trap out there is pseudoscience. These are claims that are dressed up to look and sound scientific, but they just don't have the real, rigorous evidence to back them up. Learning to spot the difference is like having a junk filter for your brain. And here's a super simple, practical filter you can start using right away. When you're online, just look at the website's address. URLs that end in .gov, .edu, and .org are generally a lot more reliable because they belong to government, educational, or nonprofit organizations. Now, it's not a perfect rule, of course, but it's a fantastic starting point for weeding out those purely commercial sites that are just trying to sell you something. Okay, tool number 3. Let's say you can make a great decision, and you've found solid, trusted information to back it up. Now comes the part where the rubber meets the road, actually using it in the real world of clinics, doctors, and, confusing insurance policies. This next tool is your guide to navigating the healthcare system. First things first, let's decode some of the language. Your premium, that's just your monthly fee for having insurance. Your deductible is the amount of money you have to pay out of your own pocket before your insurance really starts to kick in. And the copayment or copay is that small fixed fee you pay each time you visit a doctor or get a prescription. Just understanding these 3 terms can make those insurance bills a whole lot less mysterious. We all know that doctor's appointments can feel really rushed sometimes. To get the most out of them, you have to go in with a game plan. So write down your questions beforehand. Be really clear and specific about your symptoms, and don't leave until you understand any new medications and what the next steps are. I especially love that last point, asking what you can do to protect your health going forward. That puts you right back in the driver's seat.
A key part of navigating the system is simply knowing which door to open. Your regular doctor is for routine care and checkups, but for anything that feels genuinely life-threatening, like severe pain, trouble breathing, or a serious injury, that is when you go to the emergency room. No hesitation. Knowing that difference isn't just a skill, it's a critical part of staying safe. All right, for our final tool, we're going to zoom out a little bit because once you've equipped yourself to make good decisions and navigate the system, you start to see something really important, that our own personal health is deeply, deeply connected to the health of the community all around us. This last tool is about becoming an advocate, not just for yourself, but for the well-being of others too.
Let's start with a single powerful number, 20. What does that mean? Well, 20 is the number of people in the United States who die every single day while they're waiting for an organ transplant. It is a really stark reminder that one of the most profound ways you can impact community health is through a single personal choice, becoming an organ donor.
We can also advocate for something called environmental justice. It's a simple but incredibly powerful idea that no community should have to unfairly deal with environmental hazards. Whether we're talking about a factory that's polluting the air in one neighborhood but not another, or a lack of access to fresh, healthy food in a certain part of town, environmental justice is the fight for a healthy environment for absolutely everyone.
And this whole concept of community health, it extends globally. Large organizations like the World Health Organization and the World Bank work to tackle health crises that cross borders. It just goes to show that the health of one community can truly impact the entire world, and that we all have a role to play in public health.
So there you have it, 4 essential tools for your personal health toolkit. You've got a framework for smart decisions, a filter for trusted information, a map for the healthcare system, and a lens for community health. Your toolbox is now officially stocked. So the only question left is, which tool will you use first to start building a healthier future?